Hi, I'm Tay Sook Muay, and I'm a senior consultant anesthesiologist in Singapore General Hospital. I also subspecialize in liver transplantation and intensive care medicine. I just recently stepped down from being the Associate Dean for Yong Lulin School of Medicine in SGH campus.
And I'm Jiva, and I'm a first-year medical student from NUS Medicine. Let's start off with why you chose medicine.
Wow, that's such a long time ago,
Yeah.
Jiva. I think it started when I was like real young, when I didn't realize. Mommy used to wake up with shortness of breath at night. And in our young mind, we thought Mommy was going to die. Went to sought medical treatment, then she kind of like stabilized. And you know how it is when we go to clinic, right? There's the smell, you know, that. Okay, something that I associated positively with because Mommy got well. So that started. And then my sister became a nurse. And I used to follow her around in a hospital. I think my consciousness was shaped when I was young and then also shaped by my mother's medical journey. And then eventually when my sister became a nurse, that kind of became more entrenched.
My mom's a nurse also at SGH.
Oh,
So
that's
maybe you've seen her, maybe you've not. But when I was young, she used to get me to go to work with her. So I also associated the hospital smell, the environment of being in a hospital positively.
Yeah, okay.
And then I went to school, I learned about bio, and I was fascinated by the human body.
Uh-huh.
And then I think what sealed the deal was when my brother was diagnosed with Angelman syndrome. And part of having Angelman syndrome is you have epilepsy. And at one point where we couldn't control it with medications anymore, we have to rush him to A&E, right? And then I saw how well the doctors handled my brother's conditions. And at that point in time, it made me feel like he's in good hands. And I wanted to be like that for other people too. It's kind of similar in a sense that we positively associated the hospitals
Oh, okay,
when we
I
were
hear
young.
that. Yes,
And
yes.
doctors made a positive difference in our lives. Now, I wanted to ask, like, what are some of the considerations that you had when you applied for medicine?
A group of us, we kind of like bounced off each other, really, truly. Is this what we want? I decided that that's what I wanted to do. And I went ahead to apply for medicine. After that, there was an interview. Oh, that was very memorable. Because I remember it was a panel of them, having 4 or 5 panel, right? Wow. And then I'm the one of me. And at tender age, I was like so terrified. And I remember one of the questions that was asked, you know, how involved will I allow myself to be with patients emotionally? At that time, I said, as much as it takes, sir. So, yeah. Until now, I still feel this, but at the same time, we also need to take care of ourselves as a medical practitioner, making sure that we are all right, so that we are strong enough for our patients, for our community, as well as for our loved ones.
Okay.
Yeah. What were your considerations when you thought about doing medicine?
Doctors have made such a huge impact on my life, right? So I would want to be like them, and the pathway to do that is through medicine. I think it tied in with my passion and my purpose, and I think that made me want to study medicine. But I had some considerations in the fact that there's always this rumor that doctors don't have a life outside of medicine. But did you have time for yourself and to do other things that you love?
Yes and no.
Oh.
The time now is much better. So it is a good thing. It is a progression. Yes, it is tough work, long work, hard work, but it is highly doable. And in fact, when we open ourselves to that journey and learning, we are actually gaining mastery of ourselves. What do you think makes a good doctor?
Oh,
A great doctor?
okay. I think for me, what makes a great doctor would be compassion and humility and curiosity to keep learning.
Your heart is in the right place. A great doctor is also approachable, accessible, and advocates for patients. Being able to communicate, to connect, to persuade, and add on to it, there are also other things like situational awareness. All these attributes all help to make a great doctor.
May I ask you, what is your personal mantra and why?
So my personal mantra is like hoping and seeking to make the difference.
For me, I think my personal mantra would be everything happens for a reason. Every single time an unfortunate event has happened, something good comes out of it. Thank you so much for having this conversation with me, Prof. Tay. It's been a pleasure and I hope to see you around.
Likewise, I really enjoyed our conversation too.
Thank you so much for watching.